Welcome to the last sub-lecture, which is Spectrum of Disease. The outline of this lecture is Natural History of Disease, Spectrum of Disease, and Principles of Prevention and Control. Natural history of disease may begin when a person has a good health, but later on, there are subclinical changes. For example, any changes for peptic ulcer or any subclinical changes for myocardial infarction, for communicable disease when they have infected by the bacteria for cholera or by dengue virus, and later on there is a clinical manifestation, we call it clinical disease, and the last one is the outcome of exposure, either death or recovery. The progress or course of disease in an individual are over time, and the stage of susceptibility, it's happened before onset of a disease. The risk factor of the disease mainly associated with increased probability of developing the disease, and the risk determinants are age, sex, race, other socio-demographic characteristics, family history, and education. The modified risk factor at this stage are weight, for example obesity, smoking, and cholesterol, and this is the main determinant for cardiovascular diseases. The second stage of natural history of disease is stage of exposure to etiologic agent. The third stage is subclinical disease, whereby the etiologic agent present in the body but has not caused any symptoms or signs of the disease. For infectious disease, we call it incubation period. For non-infectious disease, we call it latent or induction period. Incubation period for infectious diseases has been defined as interval between time of contact or entry of agent and onset of illness. The time required for microorganisms to multiply within the host up to a threshold where the microorganism population is large enough to produce signs and symptoms of a disease. Each communicable disease has a characteristic of the incubation period, and it also depends upon rate of growth of microorganisms in the host, mainly dosage of the microorganism, portal of entry, and host immune response. In the host, the body defense against disease mainly are barriers to entry through intact skin or respiratory tract, and the immune system of the host, mainly the reticuloendothelial system, and the ability to identify foreign material such as they will include antigen of the most bacteria and viruses, and the inflammatory response triggers mechanism designed to remove foreign material. This is another body defense against a disease whereby individual host immunity can be through passive immunity such as maternal antibodies or through active immunity. The active immunity can be obtained through immunization or direct exposure through seroconversion. The other stages of natural history of disease are stage of clinical disease, stage of recovery, or stage of disability or death. The next section I'm going to talk about is spectrum of disease, and it has been defined as sequence or events occurring from time of exposure to etiologic agent to death. There is gradient of infection to illustrate spectrum of disease and the sequence of manifestation of illness that reflects the host response to the infectious agent. There are two major components of the spectrum of disease, mainly are subclinical manifestation such as exposure, pathologic changes, and the next one is clinical illness such as diagnosis and death. The spectrum of disease for clinical illness can be from the manifestations of signs and symptoms lead to clinical illness, and later the outcomes are either recovery, disability, or death. In this diagram is illustrated the spectrum of disease clearly from persons who are healthy, and also at the end are the outcome spectrum of disease. Whether a person passes through all these stages will depend upon host and agent factors, prevention, and therapeutic measures. These are the examples of spectrum of diseases of various infectious diseases. For measles, 90% cases exhibits the clinical symptoms, whereas for mumps, 66% will show the clinical symptoms. However, in poliomyelitis, only 10% cases exhibit clinical symptoms. The next concept I'm going to introduce you is principle of prevention and control. Prevention, by definition, is planning and carry out actions that prevents disease or other undesirable outcome. There are three types of prevention mainly: primary prevention, secondary prevention, and tertiary prevention. The first level of prevention is primary prevention, and the aim of this prevention is to limit the incidence of disease by controlling causes and risk factors. It also preserves health by removing the precipitating causes and determinants of departure from good health. These are the activities of primary prevention. The first one is general health promotion, mainly good health education, good nutrient, adequate housing, recreational and work condition. There are specific protection measures for primary prevention, and the examples are specific immunization, personal hygiene, isolation and quarantine, and etc. The next level of prevention is secondary prevention, and the definition is preventing the disease problem from progressing further through early detection or intervention. The aim of secondary preventions are to cure patients and reduce the more serious complications or consequences. And secondly, to detect and correct departures from good health as early as possible. The activities for secondary prevention mainly early diagnosis and prompt treatment through case finding and the use of laboratory procedure, notifications, examination of contact, screening procedures. The next activity of secondary prevention is disability limitation, mainly through complete therapy or hospitalization when indicated. Lastly, the level of prevention is tertiary prevention, and the definition is preventing the person from deteriorating into a state of helplessness. The aim of tertiary prevention mainly to reduce the progress or complication of the disease and to restore as much function as possible. This can be done through rehabilitation. The main activity of tertiary prevention mainly combined and coordinated by multiple strategies such as medical, social, educational, and vocational measures for training or retraining the individual to the highest level of functional ability. Lastly, I would like to conclude in this lecture, we have learned the natural history of disease, the spectrum of disease, and lastly, principle of prevention and control. Thank you very much.